So my name is Anthony Giuliani. I'm originally from Smithfield, Rhode Island, so local to Rhode Island. Graduated in 2017, which makes me feel kind of old now, but that's okay. And I chose URI. Well, just being from Rhode Island, I always heard about the great reputation the pharmacy program had. Had an interest in going into pharmacy, so figured that it made the most sense. And also was kind of thinking about this back in the day, but I was just, which is much more important now, but student loans is a big thing once you graduate. So getting in-state tuition versus out-of-state tuition, at other schools, just didn't seem like a good idea because I knew how strong the program was. So once I graduated from URI, I did my PGY1 residency at VA Connecticut in West Haven. 6 residents, 4 of them were from URI that year, so we were the URI crew. It was awesome. But throughout that residency, I kind of already knew I was focused on ambulatory care. I felt that it fit my strengths, my personality, and my clinical interests like really, really well. So I knew ambulatory care was going to be my thing. And then doing that first year residency in the VA helped me confirm that they have a very progressive AM care program. So I decided to take another year and do a PGY2 residency at St. Francis Hospital in Hartford, Connecticut. Had such an amazing year that year. We're a newer program. I was the 3rd resident ever to go in, but was really able to kind of pilot a lot of new programs and have a great experience and prepare me well to get my current job now. So I then, once I finished residency, I accepted a job at Boston Medical Center as a clinical ambulatory care specialist. Essentially what I'm doing is working in the primary care clinic. So that's kind of been my journey over the last 3.5 years since I graduated. I got BCACP certified. That happened in October. It was a tough exam to study for after finishing 2 years of residency. I thought I hit the finish line, but I didn't. But it was fun studying for probably that last test I'll ever take in my life. And that's kind of the point that I've gotten to today.
Awesome. That's great. Thank you for that introduction. That covered everything that I was, looking for. So what type of ambulatory setting do you work in?
Sure. So I work in a giant primary care clinic at Boston Medical Center. About 40,000 patients with over 100 providers spread across this clinic. Doctors, nurse practitioners, physician assistants, residents, everything in this clinic. And then my hospital is kind of like the safety net hospital of Boston. So a lot of our patients are, lower socioeconomic class, have a lot of social barriers. A large majority of them don't speak English. A lot of Spanish and Haitian Creole there. So big, giant, primary care clinic. And there are pretty much like 3 pharmacists, full-time pharmacists that work in this clinic. So it's like my job, and then I have two of my colleagues that do essentially the same thing in a different part of the clinic. And what we do is we kind of help support the primary care providers by specifically managing diabetes, hypertension, hyperlipidemia. Those are our primary ones. And then we also have a scope of practice in asthma, COPD, and smoking cessation. But most of the time we're just seeing patients for diabetes, which, we have to manage the lipids as well. And then blood pressure, we keep an eye on that too. But that's pretty much it. We're focused on that. We have a ton of autonomy. We can order labs, order prescriptions all ourselves through this scope of practice. So you really are able to practice at the top of your license, have that full autonomy. And like the way I explain it to people who, aren't in pharmacy, like my friends, and when they're like, what do you do? Like, you seem like a doctor, but you're a pharmacist. Like, I'm confused. I'm like, I'm essentially like a physician assistant or a nurse practitioner specifically for diabetes. That's kind of what I tell them. And it's a good way to kind of explain it to like someone who, doesn't know too much about the medical field.
Yeah, that's awesome. I think it's great that pharmacists have such a role in so many different areas. Um, I've been doing a lot of these interviews lately, and it's just interesting to see. Like yesterday, I talked to a community pharmacist. Today, I'm talking to you, and it's just completely different job settings. And I just think it's great that we have so many avenues as you know pharmacists. So thanks for sharing all that. um, so what is the most rewarding part of your job, do you feel?
So that's a really good question. And I kind of think about this, or kind of thought about this a decent amount once I started working. And it's definitely being able to work with patients every single day. Like 80% of the time that I'm working, I have patients scheduled. So I'm just calling them or connecting with them to help actively manage, their diabetes or their blood pressure. So actively impact their care. So it's super clinical. Like every single day that I'm working, I'm calling someone, I'm assessing something, I'm coming up with a plan, I'm evaluating, and always like, pretty like high level clinical um, input. So I love that that's majority of my job. But what my favorite thing, what's most rewarding is the relationship I'm really able to build with my patients. I got a taste of this during residency because you're there for 12 months, and there'd be some patients that, would really take a liking to you and you develop a good relationship with, and they start to trust you, and then they listen to everything you say, and you're like, wow, I can have a huge impact when I thought in the beginning that I wasn't going to be able to have any impact. But just developing those long-term relationships. Like I wasn't working enough in those clinics during residency to get the full effect. But now that I've working full time for a year and a half, there's so many patients that I have that I'm like very, very close with, trust me an incredible amount, in that like it's really cool. I can just look at a name and instantly know, what they're on. I know that like, Mrs. Smith isn't going to give up her Pepsi. Like we went through that avenue, but maybe we can get her to start walking a little bit more because she likes to go out and the weather's nice and see and walk down Boston and blah, blah, blah. So it's like developing those close relationships with patients is most rewarding. Like some of my patients we've become very close. I have this gentleman from India, and his wife knits these really cool hats, and he gives me one every year. I'll show you. I mean, come on. When you're in Boston, how awesome is this hat? My friends, they're awesome. I'm gonna leave it on for the rest of this question.
That's so cute. I love it.
It is great. So this is the third one he's given me. We have like a Christmas swap every year. We like exchange gifts because he always brings me something. So I'm like, I gotta get him something back. Um, and and like my friends, we go skiing and they're like, you got to get me one of those hats. I'm like, I'll try, but they're not for sale. Like they're just one of my patients. His wife is extremely talented.
Yeah, that's a special gift.
Yeah, so just developing those relationships and then seeing the impact that you have on these patients' lives over a long period of time. Because sometimes it takes a while. That's what gets me up in the morning. That's what gets me going. That's what makes me never want to quit.
Yeah, that's honestly great to hear, especially for me since I'm, on rotation. I'm getting ready to, I'm applying to jobs, getting ready to graduate and look elsewhere for what I'm going to do for work. And it's just really nice to know that you do have that impact. And that is the goal. I feel like we all go into pharmacy school and we're like, oh, we really want to have an impact. I feel like that's what a lot of people say is they want to have an impact on patients. And, you know, we don't necessarily get to see that until we're on rotation or in residency. So I think it's good to know that it is out there.
Absolutely.
All right. So how do you feel like you or I prepared you for this role that you're in?
So they have a good reputation. Like when they see the name, they know it's a good school. But I don't know. Just I think about back to like my final year during rotations, and like everything that Dr. Ward did for me to help prepare me for residency. She came to mid-year. Dr. Charpentier, she was my biggest advocate, helped me so much through navigating the process, keeping me calm. Dr. Estes obviously was, the first person I was on rotation with. She set me up on that track, and like I just felt like I could ask her anything and go to her for help. Dr. Cohen as well, big support for me. I'm probably missing a bunch. I'm missing like all the other ones, all the professors. But like I just remember like those four professors specifically, like absolutely helped me drive like myself like directly into residency without any hesitation. It was all positive reinforcement. It was all strategic. It was so much support, and like that's why when you go on rotation with a professor, you be upfront with them, tell them your goals, tell them what you want to do. And I feel like when I did that, they would push me in certain ways to prepare me for the future. And sometimes when you get to residency, like you're a real small fish in a big pond. So sometimes you can get kind of beaten down, whether that's through long hours of work or maybe not being as successful as you wanted to be because you're so new. And there can be some kind of negative feedback that you get and negative reinforcement. So it's good that they helped me build my confidence to go into that to prepare for when everything doesn't necessarily go your way throughout those residency years.
Yeah, definitely. I was on Dr. Charpentier's rotation for Gen Med in the fall, and that was when I was deciding whether I should apply for residency. I was kind of back and forth, and she definitely convinced me. She talked to me a lot and really built my confidence, like you said. So that was big for me, and she's been there every step of the way. So I definitely agree with that.
Right. I feel like those professors are truly invested in our outcomes, and they're actually like that's a big part of their job satisfaction. And I think that's very lucky, for us to get that, go through that experience.
Definitely. So the last question I have is, how do you see ambulatory care pharmacy kind of evolving in the future?
That's a great question, and it kind of really coincides with what's going on now with the pandemic. So March last year, I went remote completely for several months. So I went from doing everything in person to everything over the phone. It's quite the adjustment at first. And definitely for the first couple of weeks or first month or so, I was like, oh, I just want to be back in clinic. Like, this is difficult. But what we realized is, I would say maybe the quality of the appointment is, 80% of what it would be in person when it's on the phone. It's about 80%. But our show rates went through the roof. So like I said, our patient population, lower socioeconomic class, tough for them to just navigate Boston to come see me, to listen to me talk to them about diabetes. So, maybe our show rates at the time were like 60% or 70%. No, probably around like 65% our show rates were, which was pretty good. And we go remote and show rates are upwards of 90%. So a lot of people were kind of putting this band-aid on, we'll go remote until this settles down, then we'll get back in. We realized our model might be better incorporating a large part of telemedicine. So, I've been talking with my manager and my colleagues, and we think that going forward, a large part of our schedule should be telemedicine because of the access to patients, especially in Boston, is just so much greater. But I see that as a major shift in what I do, primary care, is a lot more telemedicine going forward. And Boston Medical Center has probably one of the most progressive clinical pharmacy, programs or staffs in the nation. Like they are, like I came from a small PGY2 residency with, maybe there were one manager and two pharmacists. And then I go to Boston Medical Center and there's 20 pharmacists with two managers with a regional manager at the top. Like they're just so progressed that I feel like a lot of other, hospitals and medical centers are gonna, start catching up to them and start allowing pharmacists like ourselves and like pharmacists doing the VA to have that, individual practice to order prescriptions in labs. And I think it's just going to keep kind of pushing forward in that way, that linear direction of getting us to be more hands-on and more clinical. And then I think it's going to shift a little bit with more telemedicine component as well, because of kind of the access with that was recognized by the pandemic.
Yeah, definitely. That's interesting you say that, because I do feel like it is easier for people to do like a phone call or a Zoom call if they have a computer, rather than trying to get transportation to get to the appointment or any stuff like that, just that you don't think about, I guess. But it does make sense that it's more accessible for people. So that is, I guess, a good thing, positive of this whole thing that we're going through. But
Yeah.
so that's great. Was there anything else you wanted to share that I didn't ask, or that, we didn't talk about?
Probably no, not too much. Actually, no. I'll share one thing about. I actually have a call set up with a student I'm taking soon. Oh, he's from URI, Ryan. I'm gonna help kind of talk to him and get him prepared for like residency interviews and stuff. So maybe I'll just talk a little bit about, because if I was in your position, this is how my brain works. I'd be like, all right, you got there. I probably want to do what you want to do, but how do I get there? How do I take these steps that I'm successful in every single direction? So I'll just give you a few tips for, navigating the residency process, interviewing well, and landing a position that you'll be happy with. So first thing is know your interests, know what you want to do. It's okay if you don't have a specific idea. Try to have a general idea. If you don't know, then go to a residency program that has a diverse experience. But just a few tips. So when you're interviewing, what you want to do is you can literally go on Google and type in pharmacy residency interview questions, and there'll just be hundreds of questions that'll pop up. Just go in your room, in your bedroom, your kitchen, and just practice those questions out loud, because you want to be able to communicate really well on interviews, and it's key when you're answering the questions to try as best you can to use real life examples of when you demonstrated what they're specifically talking about, whether it's you counseled a patient on XYZ that had a positive impact, or you caught a drug interaction on your internal medicine rotation. Anything that shows that you have been learning about the core values of the career of pharmacy, which is being the drug expert and filling in those gaps that seem, that are there from like doctors and nurse practitioners and stuff. So practice all those questions before you go on interviews. Research the sites. Make sure you have good questions that you want to ask as well, and really think back on all your rotations and reflect what had big impacts on you that you did. What kind of taught you the principles of pharmacy, and what's really going to be cemented in your head for the rest of your career that's centered around the values of being a good clinical pharmacist. And just be prepared for the interviews. And then also something that I definitely recommend, once you're at that almost finish line of finishing residency and you're looking for jobs, you want to look every single day on Indeed, on Glassdoor, on all those websites. Like have notifications set up to your phone, because the job market can be kind of tough for the clinical positions for sure, especially if you're geographically limited. And just be on those websites, be networking, go to do PPS at ASHP midyear. That got me an interview that got me a job offer in Pennsylvania. So that was definitely worth it for the jobs. And me and my boss joke about it all the time. He's like, I still can't believe that I pulled your application from Indeed. He's like, I got sent, like 2 resumes a day for the last 2 months. Like, it's so fun. I was like, yeah, I just, I just scour the internet, and most people probably have a connection to get their resume in or whatever, but he picked mine, even though it came from an outside source. And then the last thing I want to leave you with is that pharmacy is a very, very small world. So remember to always be your 100%, always be the best, because I interviewed at Boston Medical Center for a PGY2 residency, and they told me when I was interviewing next year for the job, because I went to St. Francis in Hartford, they told me that I was one of their top choices, one of their top candidates. And I'm glad I didn't know that beforehand, because I went in like, got to impress these people, and I had a really good interview. But I think it benefited me so much. I think I already won half the job over because of the reputation I had last year interviewing. And guess what? Because I was a little against going to Boston Medical for my PGY2 residency, because I was concerned about living in the city on a resident salary and moving, and I was a little concerned. So I wanted to stay a little close. So um, for financial reasons, they weren't one of my top picks at the time. So say I just walked in there and was like, yeah, I'll give it 80% today. I just ruined my opportunity to get my dream job next year because I wasn't on my A game that day. So just remember, everything that you do in pharmacy, do it 100%, because it's crazy how things will overlap. It's like, as you know, being from Rhode Island, classic, like, who knows this person, that person. Pharmacy is the same way.
That's so true. Those are really helpful tips. Thank you so much.
You're welcome.
Yeah, I have a couple interviews coming up in the next few weeks, so I'll definitely keep those tips in mind.
That's super exciting. Where are you interviewing at?
I'm actually interviewing in places in South Carolina. So I have Trident Medical Center, which is in Charleston, and then a community-based program, which is in Columbia.
Nice.
So
Nice. I interviewed at a couple of VAs down in the Carolinas.
yeah, so I'm excited, and hopefully it all goes well.
Yeah. You be prepared, you stay calm, you be yourself, and that's all you can worry about.
Yeah.
And you'll be successful, no doubt.
Yeah. Well, thank you so much. I appreciate it.